Kopala queen in. I'm a bitter pill queen in. Nexus music.
Nexus music.
But my love, I want Zaven.
Umafuna kunikontrolola, kunimenya kunita solola. Nalema nawe, nalema nawe. Umafuna kunikontrolola, kunimenya kunita solola. Nalema nawe, nalema nawe. Nalema nabo, muchikonde kumenyana, muchikonde kuyambana daily. Nalema nawe, muchikonde kumenyana, muchikonde kuyambana daily. Lega, nisisamale koneka, chikondi chinipa samanta. Nalema nawe, nalema nawe. Lega, nisisamale koneka, chikondi chinipa samanta. Nalema nawe, nalema nawe.
Lelo kashimya kama iro different story. Njabalimbi muline bomona mwechidori. Akasuba kulwa batubushi kusori. Kalumba fea kipuzima love story. Abana ndiba mona fe kwa tina lipukuta. Future no bwino I swear kubuta. Ngafya ya kuchupo chika lukuta. When you shoot your shot, gabena tukuta. Cause in the paper brain that you could be better pay. Ishitele yalo wala you better pay. Cause shifuaye ntulubundi. Ndeba chansi kuna pela kwa mtu umbi. Cause laughter umpela. Ndemona kwa tifintu na fifika kumpela. Chaba desperate, teina chikondi bega. Teti Johnson ndesha fenga sega.
Umafuna kunikontrolola, kunimenya kunita solola. Nalema nawe, nalema nawe. Umafuna kunikontrolola, kunimenya kunita solola. Nalema nawe, nalema nawe. Nalema nabo, muchikonde kumenyana, muchikonde kuyambana daily. Nalema nawe, muchikonde kumenyana, muchikonde kuyambana daily. Lega, nisisamale koneka, chikondi chinipa samanta. Nalema nawe, nalema nawe. Lega, nisisamale koneka, chikondi chinipa samanta. Nalema nawe, nalema nawe.
Nakapa personally beauty I guess apana sound kabist. Tetulande feka no wabomfya fist. If you ngo need yonse fenga middle east. Nga black jack, kanshish wabela pistik. Fulu wasumwike no kulaka. Ichimo wali kula bata mano no kulaka. Muwalwa na mano mwasuka mwakula. Boga te, gamwadi suka mwakula. Cause chilumendo your size no plani. Awe kubupuwa kwena mwapuwa hani. Bantu tufilo kwikatana nga mabani. Kuma side chick chibi wachichita bangi. Cause laughter umpela. Ndemona kwa tifintu na fifika kumpela. Chaba desperate, teina chikondi bega. Teti Johnson ndesha fenga sega.
Umafuna kunikontrolola, kunimenya kunita solola. Nalema nawe, nalema nawe. Umafuna kunikontrolola, kunimenya kunita solola. Nalema nawe, nalema nawe. Nalema nabo, muchikonde kumenyana, muchikonde kuyambana daily. Nalema nawe, muchikonde kumenyana, muchikonde kuyambana daily. Lega, nisisamale koneka, chikondi chinipa samanta. Nalema nawe, nalema nawe. Lega, nisisamale koneka, chikondi chinipa samanta. Nalema nawe, nalema nawe.
I'm feeling it. Stash on the beat.
Lega, nisisamale koneka, chikondi chinipa samantha. Nalemana we, nalemana we.
It is said there cannot be universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks of life. Join me, Tumenje Chinjili, every Sunday from 20 to 21 hours on KBN TV, DSTV channel 279 and Topstar 102. We'll also be live on ZAGO and KBN Facebook pages and YouTube channels. Tune in and share that health experience.
Let KBN TV help you reach your target audience for your goods and services. Advertise with us on any of our programs and catch your target market countrywide. Call our marketing team on 0765 193 959 or 0956 660 000. KBN TV, the finest television on channel 279 DSTV and channel 102 on Topstar.
There goes Mom again, forcing you to watch important dramas. But if you're watching this, how will you know who Burna Boy's dating? You know, actual news? The time to download DSTV is now. DSTV subscribers can link up to 5 linked devices to their account, so you can watch the best drama, celeb gossip shows and more live, or catch up on what you've missed. Just download the app, link your DSTV account, and using Wi-Fi or data, you can watch the TV you want right now with DSTV. If you're the one who pays for DSTV, then how come you never get to watch what you want? Because she calls the shots. The time to download DSTV is now. DSTV subscribers can link up to 5 linked devices to their account, so you can watch the best sports, telenovelas and more live, or catch up on what you've missed. Just download the app, link your DSTV account, and using Wi-Fi or data, you can watch the TV you want right now with DSTV.
Today's the world premiere of Queen Bee's new music video. But you won't see it, because your parents thought it would be great if you had a little brother. Like, seriously? The time to download DSTV is now. DSTV subscribers can link up to 5 devices to their account, so you can watch the best cartoons, music videos and more live, or catch up on what you've missed. Just download the app, link your DSTV account, and using Wi-Fi or data, you can watch the TV you want right now with DSTV.
Me and you, let's go to Ghana. Hey! Right, jump. This is Ghana. You've come here to seek for greener pastures. Make it your worthwhile.
Any guinea fowl you see, Guinea. Guinea fowl has nothing to do with Guinea. It's just the name of the fowl.
So Ghana jollof, what is it Nigerian beans?
What?
Have we made before?
No. Jasper! Help me!
The Africa Cup now enters the round of 16 knockout stage on Topstar. Witness the best of Africa as they face off for glory. For affordable monthly 135 kwacha antenna classic or 140 kwacha dish smart, witness all live matches and see who gets closer to becoming the kings of Africa. Starting 23rd to 26th January, stay with Topstar to watch the round of 16 games and later catch up with quarter-final matches on 29th and 30th January on World Football. But guess what?
Situation that we can't move. God, you always seem just to break through. And you know that I need you, yeah, I need you, yeah. And Jesus, I believe
said there cannot be universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks of life. Join me, Tumenje Chinjili, every Sunday from 20 to 21 hours on KBN TV, DSTV channel 279 and Topstar 102. We'll also be live on ZAGO and KBN Facebook pages. Hello, good evening and welcome to our second episode of the Inside Health TV series program right here at KBN Television. This is brought to you by the Zambia Association of Gynecologists and Obstetricians, ZAGO, with the support from the International Federation of Gynecology and Obstetrics, FIGO. I'm your host, Tumenji Chinjili. Remember, we are on DSTV channel 279 as well as Topstar channel 102. You can also follow us through on our Facebook pages, which is KBN TV and ZAGO, as well as you subscribing to our YouTube channels, which is KBN TV and ZAGO. And also to mention that on this program, we have a call-in segment where we let our viewers call us so that you are also part and parcel of this program. We want to hear your questions, we want to get your contributions, and also any clarifications that you want to get. When our lines are open, you'll be notified so that you can call or rather send us a text. So last week we looked at a very interesting topic. We were looking at ZAGO as an organization. We looked at its establishment, we looked at the structure, and also the mandate that it has to serving society. Then we also looked at the legal framework on the termination of pregnancy, which was enacted in 1972. And quite a lot was shared, and I believe that a lot was also learnt. And for the first time, it was appreciated that Zambia has one of the most liberal laws when it comes to termination of pregnancy, the law which is meant to save lives, a law that also promotes sexual and reproductive health and rights in Zambia. Well, this evening we have yet another interesting topic that we'll be looking at. We'll be looking at the magnitude and the consequences of unsafe abortions in Zambia. So this topic is designed to give us a deeper understanding on how severe unsafe abortions are, and also the dangers that unsafe abortions may have on women and also adolescent girls. To help me explore this quite interesting topic, I've been joined in the studio by Dr. Aubrey Shanzi, who happens to be the Secretary General for ZAGO. Doc, good evening and welcome to this program.
Good evening. Thank you so much, and thank you to the listeners and viewers.
Okay. As earlier mentioned, we'll be looking at the magnitude and consequences of unsafe abortions here in Zambia. So, Doc, to get right straight into it, could you just tell us who Dr. Aubrey Shanzi is, what he does, and where he's currently working?
Okay. I am a gynecologist obstetrician. Since 2013, I've been working in various hospitals. At the moment, I'm working at Levi Mwanawasa Hospital as a consultant gynecologist. I'm also working as Secretary General for the Zambia Association of Gynecologists and Obstetricians. Yeah, really working on maternal and child health, and also just helping women get quality care in the hospital where I'm working. Yeah. Thank you.
Quite interesting, and thank you for that introduction. So, to get started with our discussion, Doc, there are all these opinions from all corners of society suggesting that people did not necessarily go for termination of pregnancy or rather abortions because it is legal, but rather they make such painful decisions because of the circumstances that they find themselves in. How true is that? And could you kindly just share with our viewers these circumstances?
Yeah, yeah. I think that the reasons that women seek termination are many. I think you rightly put it that when termination comes into a mind of a woman, termination of pregnancy comes into the mind of a woman, it's really the difficult situation that the woman is in that instigates or propels her to think about it. Really, it's not what does the law say, is the law liberal, is the law restrictive. That's not really what's going on. It's a woman finding herself in a difficult situation and she wants to get around that situation, and then she starts thinking of how she's going to get around that problem. That problem might be different things. It might be that she's diabetic and she thinks that the pregnancy will get in the way of her disease. It might be because she had a bad experience during her previous labor. I've seen women come to the hospital saying that in the last pregnancy I had, I started leaking urine, my private parts got damaged, I had a bad experience, I almost bled to death. It was a bad experience to be in that situation, so I don't want to be in that situation. Other reasons might be difficult situations where maybe a father or a stepfather makes a stepdaughter pregnant. Those things are not socially acceptable. There's so much pressure for that father, so much pressure on that child who's just 14 years old and so on. So all that societal pressure, individual pressures are what really drives somebody to think about what do we do about this pregnancy, and not necessarily what does the law say. I don't think somebody who's pregnant and wants a termination is thinking what does the law say. They are thinking what do I do with this problem I have right now. I'm pregnant and I did not want to be pregnant at this point, or this pregnancy is not appropriate. So that's why that happens. Yeah.
Okay, quite interesting. Last week, the ZAGO legal advisor explained in detail the laws and the laws that allow for self-abortion. Sorry to our viewers, at this time we are just going to go on our first break. And YouTube channels. Tune in and share that health experience. It is said there cannot be universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks of life. Join me, Tumenje Chinjili, every Sunday from 20 to 21 hours on KBN TV, DSTV channel 279 and Topstar 102. We'll also be live on ZAGO and KBN Facebook pages and YouTube channels. Tune in and share that health experience. It is said there cannot be universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks of life. Join me, Tumenje Chinjili, every Sunday from 20 to 21 hours on KBN TV, DSTV channel 279 and Topstar 102. We'll also be live on ZAGO and KBN Facebook pages and YouTube channels. Tune in and share that health experience. Welcome back. Welcome back. This is Inside Health, and we continue with the discussion. So, Doc, as we were saying, or rather as I was asking before the break, last week, the ZAGO legal advisor explained in details the laws that allow safe abortion in Zambia. And it was surprising that these laws enacted as far as back as 1972, that is like 8 years after independence. Yet most of us, most Zambians, do not know that there is this law that allows for safer termination of pregnancy. Does this speak more about conservative nature of our societies?
Yeah, I think that the issue why that information is not really out there is the conservative nature of our society, but also that I think, like we all know, termination of pregnancy is a difficult subject. So it's not something that everyone goes around putting posters saying, I'm able to do a termination here, you can come, because it's by the nature of the subject, it's a difficult subject. It's not an easy subject. It's a sensitive subject. So I think that is part of the reason that it hasn't been easily visible out there. But as you've rightly put it, it's been there for that long, and it's a law that was designed to help the woman out there, not to get in trouble, not to die from complications of pregnancy and so on. So the law is there for the safety of the woman, to protect the woman's health. But because of I would say because of the politics of termination of pregnancy, it's really a hard subject to put out there. It's a hard subject to discuss, and us being a religious and traditional society makes that, and there's nothing wrong with being religious and traditional, but it makes the subject of termination of pregnancy a little bit more difficult to discuss. So you are right in saying that the issue has been our traditional upbringing, our religious beliefs, but I also think that that's not the only issue. I think the main issue is just that it's a difficult subject, because even in the developed world, in the US, for instance, it's not an easy subject, as we all know. There are people lifting placards and so on. There are groups, anti-abortion groups and pro-abortion groups fighting all the time. So it's not, some people would say no, because our society is not educated, we have so many uneducated, but it's not about that. It's just that the topic is a difficult one. Yeah.
So from just what you've explained, do health facilities really sensitize people about the services that they offer in terms of termination of pregnancy? Or it's something that's not known even to the clients that go there?
Yeah, I think sensitization is a big word, but I think in facilities at the moment, there's more knowledge, and I don't think that many people, even in our health facilities, sit up and start preaching that we do terminations of pregnancy here and so on. But it's one of the things that once somebody is in a facility, in a health facility, it's something that you come across because maybe you have a problem. Like I gave the example, some people come with hypertension, some people come with other social problems, some people come because maybe the baby in their womb is abnormal from the scan, and maybe they've been advised that go to the hospital, and maybe the doctor advises that maybe you can do a termination and so on. I think that's how people get generally in our practically, that's how people get information about termination of pregnancy. Usually it's somebody with a problem and so on. There's been very little sensitization, even in hospitals, even in out there, because I think that the people need to be sensitized about the availability of termination of pregnancy are those who are not pregnant yet. Sometimes when you're already pregnant and you're already in a problem, then you have already crossed that line and things become difficult. So it's important that the information is out there even before you get to the hospital with a problem, because once people come to the hospital, there's already a big problem. There's things to solve. Maybe the pregnancy has gone too far and things like that, and makes the situation a bit difficult. So I think sensitization should be more the media, telling community people, community health workers, public health workers, availing this information to the public, so that when that, and like I said, the key issue is that why the law is there the way it is to protect the woman so that she doesn't get into trouble. So it's not good that you get that information when you're already in the hospital. It means that you're already in trouble, and maybe you've already done something wrong. You've already used the stick, you've already drank jik, and maybe we'll talk about that later, the methods that women end up using, because they didn't have that knowledge before they actually go to the hospital. So when they come to the hospital, they've already done all these funny, illegal, dangerous things on themselves. So the law is really there to protect the woman. And to answer your question, the level of sensitization within the hospital in our society, for the reasons that we've explained, is really low. But we are hoping that as we keep talking, the community out there, the non-pregnant community, will be more sensitized instead of the people who are already in the hospital with problems. Yeah.
Okay, interesting. So, based on your explanation, will I be correct to say unsafe abortion is a silent killer?
Yes, maybe silent because I think we have a lot of women who die unnoticed. Yeah, but I think that in the facilities, we have a tip of the iceberg. We see a lot of women in facilities coming with complications and dying due to complications of abortions. So maybe silent in the sense that there's a lot of women out there dying that we don't know about, that die from complications of abortion. But also we have these women that we see in the facilities that are dying from these complications of abortion. So it's a very loud, I think, yeah, it's a very loud cause of maternal deaths and maternal sickness or morbidity. It's there for everyone to see. I think everyone knows somebody who died because they tried to terminate a pregnancy. If you ask women, men, somebody will remember someone. So it's not as quiet as that. But I think the silence maybe is in terms of how many women out there are really dying from complications of abortion that we don't know about. Yeah.
So, I've read some literature that states generally in Africa, the problem is higher than in development countries. So why is it so, and is that true?
Yeah, so deaths from unsafe abortions are very high around the world. A lot of women die from unsafe abortions, and I think over 90% of those deaths really happen in Africa. I think the reasons are many. I think a lack of knowledge, like we've already cited, about the availability of termination of pregnancy in hospitals to those who qualify, or for those who fulfill the criteria for having a termination. That knowledge is not there. The community is not really sensitized to the availability of these services. From my experience in Europe, the big difference between Europe and Africa is that the Europeans really know that the facility is there, and when they have that problem, they know where to go. I was in this hospital where they were not offering termination of pregnancy because it was a Catholic hospital, but they were telling me that everyone knows where to go when they have a pregnancy that they didn't plan for, or they have a problem with their pregnancy and they want a termination. Every single person knows where to go. So it won't happen that somebody takes JIC in Europe, because everyone knows that there's a safe way, and once they are in that situation, they know exactly where to go. They have all those private places and professional people to take care of the patients and so on. So sensitization, as we've said, knowledge from the community, the level of education, stigma is part of the reason people end up doing something unsafe. They don't want to be seen at the hospital. Maybe it's not private enough. Some people don't want to queue up in the hospitals, and so on. All those barriers at hospital level, at community level, and at personal level we end up having women in our setup using unsafe methods of termination. I think the big key is sensitizing the community and making them aware that when you get in trouble, there's help somewhere, and not really help for termination, but professional help for somebody to talk to you about your pregnancy, maybe your fears about the pregnancy are unfounded. I've had women come to me and say, "Oh, Dr. Shanzi, I want a termination of pregnancy because I just had a cesarean section 5 months ago." Yeah, once you sit down and explain that, you had a cesarean section 5 months ago, you are 6 weeks pregnant, your pregnancy takes 42 weeks. By the time you deliver, it will be a year after this pregnancy. And there's really not much risk there. The only risk there is that maybe you need a cesarean section because your cesarean sections are too near each other. And I've seen many women understand and change their mind and say, "Oh, okay, I didn't understand that. I thought I needed a termination because the cesarean section was so near," and so on. So the point I'm making is that once somebody's in trouble, they just need to know where to go. They see professional people, the professional people will talk to them, go through the risk of carrying the pregnancy versus keeping the pregnancy and so on, until the patient and the provider reach a conclusion on how to help that particular patient. So the key is that really the community is not sensitized. They go to the wrong people when they have a pregnancy and so on, and they are given wrong advice. So as soon as the community is sensitized, I think we'll get most of these unsafe abortions to go down. Yeah.
Interesting. So based on your explanation that you've just given,
yeah,
these services available in all health facilities?
Yes. I think yes and no. Yes, because every clinic or hospital has a level of care that they can give. So in clinics, usually you won't find a doctor, for instance. You find nurses, you might find clinic officers, and I think we discussed last week, like you said, the law and so on. So generally there's need for presence of a doctor in the context of termination of pregnancy. So usually at the clinic you might find some counseling services there for somebody who requires termination of pregnancy, some discussion going on, and if the clinic can't help them, they can escalate that problem and send the patient to the hospital and so on. So I think at every level, from the health post to the rural center to the clinics and to the hospitals, there's some level of availability of termination of pregnancy services when they are needed. But most of the terminations, I think, will be covered by the hospitals and the doctors in charge of the clinics that are offering the service. So I think I would say generally there's some level of availability. On the north side, I think again from the discussion on the law, there's issues of conscientious objection. Sometimes a healthcare worker thinks that the reason the woman is seeking termination of pregnancy is not a good enough reason. So they would say, no, I can't offer that service for you. And maybe they refer that patient to another healthcare worker. Sometimes some clinics won't have medical personnel to offer the service, but those, like I said, there's a continuum of care. They'll be cancelled, what the clinics can do, and then they can refer to other places when that is needed. So to some level, every facility has something they can do to help the patient seeking a termination of pregnancy. Yeah.
Interesting. To our viewers and everyone who might be joining us at this time, this is Inside Health, and we are looking at the magnitude and consequences of unsafe abortions. And please feel free to be part of this program. You can just dial the number that's showing on your screen. And if you have questions, you can just ask. You can either send us a text or you can call. Then you can also call us to give us your contributions and any clarifications that you might want to get. So to continue, Doc, I know you have been interacting with various stakeholders countrywide. So what methods do you, as an organization, what methods do people use that you have considered illegal or other unsafe methods of terminating a pregnancy?
Yeah, so when we talk about unsafe termination of pregnancy, it covers two aspects. The first aspect is that termination of pregnancy becomes unsafe when it's being done by the wrong person. The wrong person is that person who doesn't have the skills to perform a termination of pregnancy. And then the second aspect of unsafe abortion is a termination that is happening in the wrong place. Or somebody goes to a house somewhere at the corner where they say, no, there's this person who knows what to do. That termination of pregnancy becomes unsafe because it's being done in the wrong place. So all terminations must be done or must be started in a hospital setup. That's what makes a termination safe. And then the second aspect of the safety of the termination is that the person who's doing the termination should be trained to be able to do that. So having covered that aspect, it's important to know that there are a lot of methods that people out there are using to do termination of pregnancy. So we've interacted with a lot of stakeholders in the rural areas and in the urban areas. And I can start with the rural. There are medicines in the rural where women are given herbs to sit in. So they give them these concoctions and herbs, and they sit in those herbs for a while, and then, those herbs sink in, as they put it, and then the pregnancy is terminated. So that's one way that is there. Then the second way that is there that we found in the community is that, again, people in the community have these herbs that they ask women to insert. They insert these herbs, different plants and so on, in the private parts, and then they wait and see what happens. Apart from herbs to insert, there's also sticks. So we've heard about women using cassava sticks. Cassava sticks are quite famous for termination of pregnancy. I don't know what is it about the cassava stick that people choose to use the cassava stick. I've seen reeds, grass being used. A woman goes to someone, they put them in a position that they can insert a stick in the private parts. We've seen bicycle spokes being used to terminate pregnancies, where people end up damaging the uterus, making a hole in the uterus, damaging the liver, and so on with all these sticks. All these things that have been seen. And then apart from sticks, spokes, grass, reeds, women also use tablets, things that they can drink now. So overdoses of tablets, Panadol, paracetamol, that's paracetamol, of course, caffeine, chloroquine overdoses. People talk about concentrated tea and so on. Some people have drank jik and so on and so forth. So really dangerous stuff. And like I keep saying, and really unnecessary in 2022.
So,
yeah.
Doc, just there, you working at Levi Mwanawasa Hospital, how often do you come across these cases?
Yeah, so at Levi, I think there are not so many coming at Levi. I would say in a setup, like a district and general hospital setup, you would see like 2-3 women every year or so, like one woman every quarter that you see who has used a stick. So like so a quarter in a year is like 3 months, isn't it? So every 3 months you see someone within the hospital. But Lusaka is so big, there's so many hospitals, there's so many clinics and so on, so everyone is having a share of these patients. So yeah, in a hospital the size of Levi, you would see like one patient maybe every quarter of a year with who has used the stick or has died from complications of trying to have an unsafe abortion. Yeah, so Lusaka is quite special because of the number of facilities and so on. So you need to put all the numbers together for you to see really that the problem is quite big. Yeah.
So when it comes to issues of termination of pregnancy or other abortion, in society we've attached this topic to people who are single, or rather who are not married, and to the age group of maybe teenagers. So does it ever happen that at a health facility a married woman comes and asks for these services?
Yes. So I think we need to understand that, like somebody said, where there are men and women, there will always be sex. Where there's sex, there will be pregnancy. Where there's pregnancy, there will be unwanted pregnancy. And where there's unwanted pregnancy, there will be unsafe, or there will be abortions. So this problem does not really choose. It covers everyone, girls, women, married, unmarried, and so on. Everyone is really affected. We did a study on reasons that women come to ask for termination of pregnancy in hospitals, and what we found was that 30% of those women who came were actually married and so on. So the need for termination doesn't seclude people who are married, because sometimes people who are married are having, like the example I gave at the beginning, she just had a C-section 5 months ago. Now she thinks it's unsafe and she wants a termination. You have a married person who has heart disease, and that heart disease is not compatible with the pregnancy. You have a married person who's having her 8th pregnancy, and her child is too small. Like, I'm still breastfeeding now, I'm having my 9th child. You have a lot of couples coming and saying that we can't afford another child, for instance. So it's not limited to adolescents and so on. You actually be surprised that the people that we are thinking will come for termination, the adolescents, are not really the ones that even come. Because adolescents, the difference between adolescents and adults is that adults have social networks. They know a doctor, they know a nurse, so they'll make a phone call and say, oh, I have this problem. Adolescents don't have that kind of network, and that's why actually most of them are the ones that end up with sticks and taking overdose of Panadol, because they don't have networks. When you're an adult, that's really what an adult means. You are connected. You have this person that you can ask, you have this other person that you can ask, and so on. So you find that the people that are really coming to ask for terminations are the adults, and really the married. Like I've said in that study, 30% were people were actually married. Yeah.
So in Zambia right now, how does the picture look like when it comes to statistics? Let me put it, which part of Zambia, rather province or town, has the highest number of these cases of unsafe abortion?
Yeah, so that's a very important question, but also one that is very difficult to answer. It's difficult to answer because I think the way we keep information in our country is very poor. I think it starts as the way we are raised, the way we don't keep data properly. If you ask someone how much do you spend on, for instance, airtime every month, people don't know. How much do you spend on groceries? Because we are not keeping information properly. No one keeps receipts, and at the end they tally, I use this money for this, I use this money for this, and so on. So our information keeping systems are very poor. But coming to your question, the general picture about termination of pregnancy is that the information that we have right now is that the number of deaths of women of reproductive age from unsafe abortion is somewhere in between 6 and 10%, depending on who you ask. That's the current information that we have. So somewhere between 6 and 10% of deaths of women of reproductive age are due to unsafe abortions. There was data last year about Copperbelt being the place where there were a lot of unsafe abortions and deaths from unsafe abortions. I don't know why, and I don't think that data was collected to find out why it happened like that. But Copperbelt was cited as one of those places where the numbers of unsafe abortions were actually high. I think the numbers are for 2020 or 2021. But bringing down the numbers to like districts, I don't think we have enough information at the moment. We just have this general picture that 6% of women who die from complications of pregnancy are due to unsafe abortion. And from the data that we have from a year or two ago, Copperbelt was cited as the place where most of these unsafe abortions were happening. Yeah.
Okay. Remember, we are looking at the magnitude of unsafe abortions and also the consequences of unsafe abortions. We'll now go for a commercial break, and when we come back, we'll continue with our discussion. And remember, you can also be part and parcel of this program by dialing the number that's showing on your screen. We'll be right back. And rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks of life. Join me to Menje Chinjili every Sunday from 20 to 21 hours on KBN TV, DSTV channel 279 and Topstar 102. We'll also be live on ZAGO and KBN Facebook pages and YouTube channels. Tune in and share that health experience.
Let KBN TV help you reach your target audience for your goods and services. Advertise with us on any of our programs and catch your target market countrywide. Call our marketing team on 0765 193 959 or 0956 660 000. KBN TV, the finest television on channel 279 DSTV and channel 102 on Topstar.
There cannot be universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks of life. Join me to Menje Chinjili every Sunday from 20 to 21. Welcome back. This is Inside Health, and we are looking at the magnitude and the consequences of unsafe abortions. So we continue, Doc. You've explained a lot about unsafe abortions. So what are the common consequences of unsafe abortions?
Yeah, unsafe abortions are a huge cost for a woman. First of all, I think that she loses her money because she'll go to these quacks in the community because she doesn't know better, or she's afraid of all these things that we've talked about, the stigma, and that people at the hospital will know. They want to keep the information private. She ends up in a community where she loses her money and ends up with an unsafe abortion. So there's a lot of economic loss for this woman. Then the other loss, of course, are health problems that arise from unsafe abortion. Like people use those tablets we talked about, overdoses of Panadol, overdoses of Cafino, and so on. All those things can damage livers, they can damage kidneys, and so on. But again, women don't know that there's help for them in the facility, so they are in a desperate situation, so they end up using all these methods. The ones that use sticks, for instance, they end up with damaging the uterus, they end up with pus in the abdomen or in the tummy. They come to the hospital, we do surgery on them. We've removed a lot of uteruses from young women, 18-year-olds, 16-year-olds who had used sticks when they were terminating a pregnancy. So they end up with no uterus, they end up with damaged, their inside gets damaged. We have women who end up with infertility because the instruments that were used to do a termination of pregnancy were not clean enough. They ended up with infected uterus, infected tubes, infected ovaries, and so on. And therefore, they end up being unable to have a baby. The other thing that happens when women do unsafe termination of pregnancy, women and men usually do unsafe termination of pregnancy, is that women end up with chronic pain. So this woman has pain in the abdomen that never goes away after a termination, and so on. So those are some of the big issues that can happen when a woman terminates a pregnancy in an unsafe way. So they can lose their uterus, they can end up to be infertile, they can end up with pains that can never go away in their tummy, and so on. And losing fertility and so on has grave consequences for a woman psychologically and also in the community, because being reproductive is part of who we are as humans. So somebody not being able to reproduce because their uterus was removed, because they had done unsafe abortion, is a big torture to women psychologically in the community. So those are some of the consequences that can happen as a result of unsafe abortion. Yeah.
Okay, so when one goes to a health facility to access these services, is there a cost attached to that?
So generally speaking, there's not supposed to be any cost. It's supposed to be free. It's supposed to be like any other service. Because when you come to the hospital, you come with a problem, isn't it? Your problem can be fever, your problem can be that your leg is broken, your problem can be that you have a headache, your problem can be that you have a pregnancy and the pregnancy is causing some problems, whatever those problems might be, and you want advice on what to do next. So there shouldn't be any cost apart from the cost that you get when you come for a malaria treatment. When you come, there shouldn't be any cost. But having said that, sometimes there are these because of the nature of termination of pregnancy, sometimes you find that some dubious healthcare workers might take advantage of a patient and try to get money from them and so on. And some patients sometimes just say themselves, the patient just say, no, help me, I'll give you money and so on, so that it's private, just between the two of us. I don't want to be coming in the hospital setup because everyone can see. So those are some of the ways that maybe a patient ends up paying something, but that's not the correct way. It's been found, actually, there are some studies done, I think it's Professor Volika's studies, that because of these hidden costs of coming to the hospital, transport money, healthcare workers asking for some money, and even patients themselves wanting to pay for the service so that it's kept secret. Patients pay somewhere in between 1,000 to 2,000 to have a termination of pregnancy, but that is not the way it's supposed to be. It's supposed to be free like any other service in the hospital. Yeah.
Okay, so as we are coming to the close of the program, what could be your brief concluding remarks?
Yeah, my concluding remarks is really what we've already talked about, that to the viewers out there, there's no need for you to suffer alone when you have a pregnancy that you are not ready for. There's help for you in a hospital setup. You can come to the hospital, you explain your problem. There are people that can counsel you, people that can help you and get you through the problem. Don't struggle by yourself. Then the second point is that let's not use sticks, let's not use drugs at home. Let's not go to private pharmacies to get drugs to terminate a pregnancy. Let's find our ways to the hospital and explain our problems, because as we explained, the safe termination is one that is done in the hospital and done by people qualified and trained to do such. Let's not go in the community and try to solve this problem by ourselves, because we can end up in all these troubles, these consequences that we've already discussed. So those are really my last words, that there's no need in 2022 for a woman to die because they used a stick to terminate their pregnancy, because they used an overdose of Panadol, because they drank Boom, they drank Doom, and so on. There's really no need for such things in this time and age. That time has really passed. Let's do the correct thing. Let's go to the facilities. Let's ask the correct people so that we get helped. Yeah. Thank you so much.
Thank you so much, Doc, for being part of this program. It was a pleasure, and we hope to have you again some other time.
Okay. Thank you so much.
To our viewers, we've come to the end of the program. Remember, we were looking at the magnitude and the consequences of unsafe abortions. Thank you for being with us and following through this program. We can still get interacting on our social media platforms, which is Facebook as well as YouTube. Remember to put those reminders that we'll be here every Sunday from 20 to 21 hours. I'm your host, Tumenji Chinjili. Till next time, it's bye-bye. It is said there cannot be universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks of life.